Hello, everyone, and welcome again with with Maya Z. This is Maya, and you already recognize my voice. And today I am with a very interesting patient advocate, Joy Milne. Joy, I actually met Joy. She proactively reached out to me saying, "Hey, I want to volunteer. I want to say more about the standard of care and patient engagement and what's wrong with Parkinson and research in Parkinson." And then we had a brief conversation that totally confirmed for me that Joy is someone that I need to interview, and probably we won't have enough time for just one interview. But why? Because Joy, first of all, she's working at the University of Manchester, and for many, many years, she's been struggling to first having different family members struggling with Parkinson's, so having to take care of them on one side, but on another side, to actually speak loud about the issues of the disease and the issues around research, the issues around patient engagement. Second, because Joy is a trained patient advocate, let's put it that way. So it's not only that she's been doing this work for quite some time, but actually Joy is a part of an institution called UPATI. For those who don't know, that are outside of Europe, UPATI is like the easiest way to explain that is the Patients Academy, an academy that's whose mission is to raise the patient's voice and to educate more patients to become patient advocates in a more meaningful way, so that they can actually contribute with their knowledge to the industry and to research in general, so that at the end of the day we have a better alignment between both, and it's actually one stakeholder, not two different separate voices that don't speak the same language. So Joy, I'm extremely happy to have you aboard. Thank you for making the time. Welcome once again. And yes, please start with a short introduction on your end.
Yeah. My name is Joy Milne. I was a carer for 49 years with my mother-in-law and my husband with Parkinson's. Uh, just before he died, I walked in for our first meeting of Parkinson's UK and promptly walked out again. I have what is called hereditary hyperosmia. And I knew my husband's smell had changed 12 years before he was diagnosed, but I didn't have a place to put that smell. I had been a nurse and I had only had one contact with a female with Parkinson's, but females with Parkinson's smell slightly different from males. I'll tell you about that because I did quite a bit of work on that. So, having found that there was this smell, my husband was a consultant anaesthetist, he decided that we had to do something about it. It was urgent to him. I mean, he was in his last few years with Parkinson's. His health was failing rapidly. But he chose Professor Thilo Kunath, went to one of his meetings, and he stood up and said, "Why are you not using the smell of Parkinson's to diagnose it earlier?" And I do wish I'd had a camera, because Thilo and I are good friends now, but his face was, "What are you talking about?" Since then, he introduced me to Professor Tito Barn, and I work at Manchester University within the biotechnology unit. However, I also became involved with the PD Avengers. We formed another group, a women's group, to identify that women aren't little men in Parkinson's. We are different, or they are different, and that the difficulties my mother-in-law had, we were soon to discover, because I openly spoke about it, that we were soon to discover that many other women had the same problems, especially around the week before their period and going through the perimenopause and the menopause. And men don't have that. So they don't have those hormones that interfere with the neurological setup of their body. So that was very interesting, and some very good papers, especially with Dr. Sonia Mather and the CEO of Cure for Parkinson's Trust, Helen Matthews. We did a very good job there in making it apparent that there was this difference and it had to be catered for. I've done other things like doing studying in UPATI, because I found it was a friend, Mark Van Grieken, who encouraged me to do it. But in actual fact, the course itself was so illuminating. It was fantastic. And it has helped tremendously towards my advocacy on how I look at things. I've also I'm head PPI in a study for carers for Parkinson's as well. So I am forwarding this all the time, but I have been to the first person-based approach conference in Gothenburg last year, and met Jana Berkowitz. And we are forming a group to forward this person-based approach and how medicine should be looking at this. The Philippines have done it. They're doing it in Australia, Canada, New Zealand, and
That's interesting.
superb results.
I have lots of questions there, but let's first start. Yes, I'll make a note like to ask you about that a little bit later. But first, tell me, I'm listening to your story, and now you're sharing even more details than the last time we spoke. And I'm thinking, what is it like to be on the biotech side of things, where you're literally working towards the discovery of new technologies and new medicines, hopefully cures, and at the same time being a caregiver? How is it like to be on the side of two different battles? And
I
yeah,
think
how do you feel about it?
on my husband's, how I feel about it is on my husband's deathbed, he said to me, "You must do this. You must follow this. You must keep going." And I think because he was an international swimmer, he was looking at the Olympics now, and he would have loved. We did go to a couple of Olympics to see the swimming, and so it was for him. It was a must. So I live with that inside of me because really I don't think people have understood Parkinson's at all up until now.
Hmm.
The normal,
Yeah.
it's like one of my friends that I work with in Parkinson's, Matt. Matt has a T-shirt that says, "I am not drunk, I have Parkinson's," because he's been accused in the street of being,
Oh, wow. Yeah. Well, something you said last time, which was absolutely striking, was that we don't have a new medication approved for the last 60 years, 65
yes,
years. Is that
yes,
correct? Like for Parkinson's, I mean.
yes.
Do you know why? Like, yeah,
Because
how come 65 years we speak all the time about innovation and how technology and AI and everything, and then again 65 years, 60 years later, we have
and
nothing new for such a serious disease.
and it has terrible side effects. I mean, the off periods with it are horrendous. You can be 1 minute, as normal as you are in Parkinson's and getting on with your life, and then all of a sudden you have an off period, and it can be so sudden that you are absolutely completely washed out. So it's not a medication that has a period that you think, "Oh, I'm safe. I'm going to be all right taking this medication." Like a lot of like diabetes and insulin or cardiology and some of the tablets, etc., your high blood pressure, that doesn't exist in Parkinson's. And the off periods, you don't know when they're going to come, and they can be really extreme. Some of them aren't, but some people have extreme. You must take your tablets on time. You must take them at the same time every day. The technology scene has become, things beep to tell you that you have now to take your tablets, which is very good because when Les was first diagnosed all those years ago, there wasn't anything like that, and we were not told. I think one of the worst things about, well, there are several, but one of the worst things is the diagnosis. You go in to see a neurologist, you're there for 20 minutes perhaps with your first um, diagnostic interview, and you're told you have an incurable disease. And people
So
write a
what stops, yeah, uh, I was wondering what stops research from progressing, Joy? What is it about Parkinson that, I mean, I probably it's a very vague question, but I really, like, what stops research for progressing in Parkinson? I know Parkinson is not the only disease like that, but
I have
60
been
years.
involved, yes, I have been involved on two camps. So alpha synuclein is the protein that is supposedly causing the problems. Manchester worked with Professor Daniela Berg, and I've listened to Professor Reader at the World Parkinson's Congress speaking about, and they work together, speaking about the fact that is alpha synuclein a goodie or a baddie? The majority of people in researching in Parkinson's and neurologists think it's a baddie. However, for me, with my hereditary sense of smell, we know that in the sebum, that is where, and Professor Reader did this lecture at the World Parkinson's Congress, saying that the highest amount of alpha synuclein is found at the back of the neck, around this area here, round your neck, on the back. Where do I find the smell is worse? Round the back of the neck.
Hmm.
That's where we
Okay.
take the swabs. Now, on the testing with Manchester, they found that the sebum in these swabs, which is taken there by alpha-synuclein, is showing the dysregulated lipids, how ill a person is, how good they are, and what the problems are.
It's very interesting. And you mentioned that Parkinson is very different with women and with men. So I wonder, since you're also a patient advocate, what work is out there to actually recognize these differences? Um, is industry working towards recognizing that, first of all? And you as a patient advocate, do you feel that you've contributed somehow so that we can have different type of research for both women and men?
The response has been fantastic, simply because there have been a set of women with Parkinson's in the world, Sonia Mather and Risha Flanagan. There are many of them, actually. I could take up the whole hour mentioning that we rallied a body of people, or we maybe instigated a sort of revolt, because the meetings were fantastic. The paper was fantastic that Sonia wrote with many of our other women with Parkinson's. But we did a huge study with Michael J. Fox, who's speaking about, I can't remember how many thousand questions in it. And you could go back and go back into it and go back into it. And we went literally from having your period to after the menopause. So we had different sections that were filled in. And the results, we were getting feedback on results, and it's phenomenal. And I think there were 10,000 within the first few months of women.
Wow.
So it sparked something that was needed. However, what happens is women go to their GP or what you call your general physician, and they were being told, "Oh, well, you've your periods, you've got problems with your hormones, you've got it, your skin. Oh, well, you've got this breakout on your skin. Oh, well, that's just around your period time, and oh, well, that's normal probably." And they get treated for that, and they get treated for feeling down about it all, and they get treated because they're not sleeping properly. And they get diagnosed later than men, unless you get it really good.
Yeah, I've heard somewhere lately, I watched a video actually explaining that the women in general get underdiagnosed
Yes.
because when they go to the doctor, they are being explained, oh, that's your period, that's just like normal with women. Oh, you feel like anxious, you have like young kids, for example. To be honest, I had like a similar type of thing a few months ago where I was really feeling down and I couldn't like even wake up properly. And I was like telling my husband, if there's something wrong. And everyone I was saying that too, they were like, oh, you have small kids and like with the company and all the things that you're doing, you're just tired. I'm like, guys, but I'm doing that like, it's not the first time I'm doing that. I'm doing it all the time. But now I feel way more tired. So it took me months actually, and one really diligent doctor who actually got my lab test during a preventative like check to realize that actually I did have some issues with my I don't like some vitamins basically that are critical for you feeling like well and energized and having proper sleep. But for months I was thinking that I'm crazy and something's wrong with me, literally, and nobody really paid any attention. And I can imagine, like, when it comes to something even more serious, what it's like. So, how can we address that, Joy? How can we encourage earlier diagnosis in Parkinson's? Because for diseases like Parkinson, Alzheimer's, and many, many others, how early you actually get the diagnosis plays a huge role in how you're going to be treated. Because today we have medications that can work when you're in your early days, and you can at least slow down the progression and live longer and better quality. So what can we do in order to encourage this early diagnosis
Well,
within women, but also men?
there's
Mm.
the stigma of having Parkinson's slows everything down. And the stigma, people have to accept and be open. Until this happens, that general public know more about Parkinson's, they know more about the horrible side effects of Parkinson's, they know the stress and strain that go on to your spouse or partner and your family. We have to be more open about it. And we have to appreciate in universities that there is not enough understanding of that for young medical students. Now, I know in Oxford they have access to speaking to the medical students. That should be happening all over the world. It should be
Interesting.
so that that side of the young doctor becomes aware that this is really interesting, for one, but should be motivated to look at it more clearly. If a patient is coming backwards and forwards to you, and you've seen them maybe in 3 months, you've seen them 4 or 5 times, there should be alarm bells. If you can't see what it is, but they're telling you something. So it would be really good for medicine and the education of medical students within universities to look at this. That would be one thing. The stigma that the actual person with Parkinson's is more open about it, and they can go and speak to the rest of their family and their friends. And I know it's hard. I know it's very hard because the side effects, not only of the L-DOPA, but also patients are still getting agonists. It's a type of tablet that causes fixations, gambling, sexual indiscretions, etc. And they're getting this along with the L-DOPA. And that I noticed on my tablet yesterday that somebody was questioning, why are we still getting agonists? A woman with Parkinson's saying, why are we still getting, why is it not being questioned? Why is it not being looked at? Okay, it gives you hype, it makes you maybe feel a bit better, but the side effects are dreadful.
That actually opens another question. How are people with Parkinson's treated differently in different countries, Joy? I mean, are you aware of the standard of care country by country? Is it very different, let's say in the States compared to the UK, or let's say compared to Russia, and or somewhere China, in another part of the world?
Natasha Misbah, she has done so much to actually bring this forward. Professor Richard Walker and Ndiji, a professor in Lagos, the work they are doing is phenomenal. No other country is doing what they're doing. To say this has been done in 6 countries in Africa is amazing.
Wow.
They are doing all different kinds of diagnostics. They're doing saliva, they're doing the sebum, they're doing our test, they're doing genetics, they're looking at care all through it, and they are training staff. The staff are going out into these villages on little mopeds, and they are really bringing together a vast amount of information. It is an astonishing process, and it really is. It's taken them, I think it's taken Ndiji and Richard 16 years to put it together. Natasha, actually, Tash as we call her, she is in charge of running it. She's a young scientist, but she is so dedicated to it. It's really surprising. And people like Albert and across in, I think it's Tanzania he's in, they're so enthusiastic. I mean, if we had that all the way through the world, we would sort this out, I assure you.
And Joy, you also gave me, you told me another story as part of your patient engagement experience. Basically, when you were part of a committee for providing feedback on a clinical trial, what it was like, and actually, um, how much does the industry try to understand the patient journey before planning any of the clinical trials that are coming next? And what is the process like?
Yeah, the process is very hard. NIHR, the National Institute for Research in the UK, have a very, very good setup. They really do for PPI. They've been trying to make inroads into industry for many years, for 40, 45 years. And the setup should be good. However, the training is not, it is getting better, but I am head PPI and I have to take some blame myself. I did not understand at first the intricacies of actually training a PPI team and then bringing together, you're like the thorn in the middle if you're the head PPI. So you've got.
And so I'm sorry, can we go one step back? Can you define PPI just to make sure that I understand correctly?
Patient-public involvement. In every
Okay,
research
thanks.
for NIHR, they must have a group of patient advocates, people who are actually have experiencing of what is happening in that disease. So I have a very good group of carers, dedicated carers who have taken quite a lot of interest in other parts, being head of local groups and other research, etc. So when I started, I didn't realise I had done a lot of education. I had read a lot of, I had gone through UPATI, so I knew there was a grounding that, you had to follow and you should be. What I didn't understand was that the research side, we're not going to educate the PPI, my fellow PPI group, on what they were doing. So there is this gap that has to be crossed. There has to be a liaison of education.
So what you're saying, let me see if I understand correctly. Let's say the research party will ask you questions without necessarily giving you the context of these questions. And you have
Yes.
to answer these questions, but you kind of like, without knowing where this is coming from, you may provide an answer that actually is misleading to the researchers without understanding their context. So how do you imagine this training actually happen? Is it more of a general type of a training, or do you imagine a training on the science, like the type of science that the researchers are planning on doing?
Well, there's two things here. The first one is we were going forward, and I was getting a little bit of rumbling from my fellow colleagues on the PPI team, and I went to a general meeting. I'm a co-applicant, so I'm into a general meeting with the researchers, and I said, "Stop! I'm stopping." And they went, "What?" I said, "We have to go and educate the PPI team to what you are actually doing. How can they understand what you're doing if they don't have the education?" Now, this was on Think Aloud questionnaires. None of us had dealt with Think Aloud questionnaires. And I think it was a misunderstanding between the two groups. Now, I have to say, the research group then responded, but they responded so far, but no further. So we had to go back again. And this time, I took it upon myself to find NIHR and various groups what was a Think Aloud interview, how it ran, what its principles were, when the questions were there, the answers, and how they assessed those answers. And there was a whole protocol for doing it that we knew nothing about. So it's not only, they didn't know about being a carer, but we didn't know what they were doing.
Yeah.
And that gap has to be filled. I think we did it quite well. There were still a few things that have been left behind because we didn't have that good beginning. So has to be there at the beginning. The researchers have to realise that they must liaise with the PPI group, give them the insight, the full insight into what the research is about and how it's going to be carried out. On the other side, the PPI team have to understand that the responsibility of the results in the research are left at the door of the researchers. However, they usually want to have a huge input. So there has to be an agreement between the two groups that how it's going to be carried out. And that has to be done at the very beginning. You have to be liaison, a friendly liaison and a respectful liaison between what is for either group and what you do together.
That's very interesting. And not only interesting, very inspiring, because I like the word liaison. That it should be, it just comes with synergy. It comes with collaboration, with common goals. And very
Yeah.
often, and I agree with you, Joy, without having at the very beginning, what is the common goal that we try to achieve, and without underestimating each other's role and importance in the whole process. If we don't do that, then we'll end up being misled with wrong expectations. Sometimes it's like you said, and just at the very beginning to get on the same page and then continue. I just wonder one other question around that. What will happen if the researchers, what will be the implications if the researchers don't get adequate response from the PPIs and from the patients on the other side?
Well,
Patients, carers.
it is well known, it is now very well known and written about the input, the good input, proper input of a PPI team enhances the results of any research. Now, if the researchers don't accept that, they're not going to produce a relevant result. Whether it is with, as it is for me and them, they're producing an app for carers to help them in their everyday life to cope with Parkinson's. Now, if they don't listen and make assumptions, which they're not liaising with us, things could go a bit awry. But we're going into work stage 2, things are far better. And I think there's far more understanding in how it can be achieved because it is well written. People have researched it. It makes the results of a research study far better.
Do you have the opposite story, Joy, where the researcher didn't really take into consideration the patient's journey, and they produced, let's say, clinical trial, but that goes. Is that what actually happened in the past 6 years or so, and therefore we don't have any good results, or it's a too big of a statement?
I think they're looking at 56 million or $56 billion have been wasted because they haven't.
Oh wow!
It's in that, and it's well written up. That is also that has been studied because the incentive to stop this waste of money in research is huge, and they now know that this can be solved. This PPI input, however, need to get this liaison, this cooperation, this understanding. It is absolutely crucial.
Indeed. Thank you for sharing that, Joy. I have so many questions, but maybe can I have just one last question? Because you started at the very beginning about that, and you mentioned some countries where I speak about the person-based treatment. I think you speak about personalized medicine. If I'm not, is it actually different to personalized medicine, what you're speaking about?
Yes, because doctors and nurses, I'm a nurse and my husband was a doctor.
Mhm.
He was very good at the person-based approach.
Person-based approach, yeah.
He just naturally had that, and it was lovely how people came back to me and said, "Oh, isn't he good? And he's done this for me and that for me." But he saw that because his mother had Parkinson's, he had been a carer from a very young age, and that's where the difference came. His father had died when he was 11. By the time he was at 11, 14 years old, he was a full-time carer for his mother. Yet he did his tires, he became an international swimmer, he
Wow.
did all the right things. So he had that inbuilt from being a teenager, understood. So, but if you look at the Philippines, they have built a hospital system on it. And it was astounding at the Copenhagen conference to hear what they'd done. And Professor Wolf, who is running it with Jana Berkelet, we did workshops, and I think I gave you the experience. The first workshop I did, it was round tables, and the first workshop I did, it was PhD students and patient advocates, etc. And it was loud, it was discussions going backwards and forwards. And the next one was researchers, total silence. And I said to him, "Well, what do you want to speak about?" Somebody mentioned the lay summary, and I thought, yes, that is a very good point. And I have a lot of background knowledge on the lay summary and how it matters and what it should be and how it should not have any scientific speech in it.
Yeah.
It is
Yeah.
for the
True.
people who are going to be involved who are not scientists. And simple things like that. And by the end, yes, I said to them at the end, please come back to me in the 4 days of the conference if you have any other queries. And we had little tables. I would get a few people together in the day and we'd go and speak about it. It was the researchers continued to ask the questions. The PhD students and the patient advocates got it. They were in it. But the researchers had to come back and keep on asking questions. And it was interesting. It worked, though. I said to Jana at the end, and I am in this group that we are forwarding in the person-based approach with Calgary University, Canada. They are superb group. There were 3 of them there, and absolutely superb group. So it's interesting.
Oh, this whole conversation, even though like we had you shared some really tough stories, and I'm so thankful for your transparency and your humbleness around all the things that you're doing. But it's very positive at the end because if I'm to summarize, even though we didn't have like the progress we needed in Parkinson's when it comes to research and the results we wanted. I kind of feel from your story that we're on a better track now. That's at least in this area, patients and carers are way more engaged, and there are people to listen and people to really drive forward this liaison. People like you, and I just hope that this will be across every single disease, no matter which, because yes, no matter what type of disease you have, no matter how severe it looks on the outside, it is something that you struggle. So I respect every single person in their own battles. And I even more respect people like you who, despite the battle, they find strength in the battle and actually make something good for the other people. So thank you very much, Joy, for sharing this and for all the work that you're doing.
It's a pleasure. It's a pleasure.